Let me start with a story that will make you furious. A man in California went to his local hospital for a routine colonoscopy. He had insurance. He checked that the hospital was in network. He verified that his gastroenterologist was in network. He did everything right. A few weeks later, he got a bill for $3,000. He called his insurance company. They explained that while the facility and the doctor were in network, the pathology lab that analyzed his tissue samples was not. He owed the full cost. That $3,000 bill turned a routine preventive screening into a financial nightmare. But here is the kicker. He could have avoided the entire bill by asking one simple question before his procedure. One question would have saved him $3,000. By the end of this video, you will know exactly what the copay trap is, how it differs from a deductible, and the 5 specific questions you must ask before any medical procedure. I will give you a script to use with your doctor's office, your insurance company, and the hospital billing department. You will learn about the hidden facility fees, the pathology trap, and the assistant surgeon surprise. This is not about avoiding necessary care. It is about avoiding unnecessary bills. Let me start with a definition that most people get wrong. A copay is a fixed amount you pay for a covered healthcare service, usually at the time of service. For example, you might have a $30 copay for a primary care visit or a $50 copay for a specialist. That sounds simple. But here is the trap. Many plans now have what are called tiered copays. A visit to a primary care doctor might be $30. A visit to a specialist at a hospital outpatient department might be $100. And a visit to a hospital emergency room might be $300. The same service, the same doctor, but the copay changes based on where the service is delivered. That is the first trap. You think you are seeing a specialist for a $50 copay, but because that specialist is affiliated with a hospital, you are charged the hospital outpatient copay of $150. You did not know. You did not ask. Now here is where it gets even worse. Some plans have copays that apply per service, not per visit. If you go to the emergency room, you might have a $300 copay for the facility. Then you have a separate copay for the emergency room physician, maybe $150. Then a separate copay for any x-rays or labs, maybe $50 each. A single emergency room visit can generate multiple copays, totaling over $1,000. That is the $1,000 copay trap, and you do not find out until the bills arrive. Let me break down the 5 most common copay traps and how to avoid them. Trap number 1 is the hospital outpatient department trap. Many doctors' offices are now owned by hospitals. When you see a doctor at a hospital-owned clinic, you are often charged the hospital outpatient copay, which is significantly higher than the office visit copay. The same doctor, the same exam room, but a different billing code. To avoid this, always ask when you schedule an appointment, is this clinic considered a hospital outpatient department? What will my copay be? If the copay is too high, ask if there is a non-hospital affiliated clinic you can visit instead. Trap number 2 is the facility fee trap. Even if your doctor is in network, the hospital or surgical center may charge a separate facility fee just for using their space. For an outpatient surgery, the facility fee can be hundreds or even thousands of dollars. Your insurance may apply a copay or coinsurance to this fee. To avoid this, ask for a written estimate before your procedure. Ask the hospital, what is the facility fee for this procedure? Will my insurance cover it? And what will my out-of-pocket cost be? Trap number 3 is the pathology trap. When you have a biopsy or any tissue sample taken, it is sent to a pathology lab for analysis. That lab may be out of network, even if your hospital and doctor are in network. You have no control over which lab the hospital uses. To avoid this, before your procedure, ask your doctor, which lab will you send my samples to? Is that lab in network with my insurance? If it is not, ask if there is an in-network alternative. You have the right to choose your lab. Trap number 4 is the assistant surgeon trap. For complex surgeries, the lead surgeon may have an assistant surgeon. That assistant may not be in network. Even if the lead surgeon is, you often do not meet the assistant surgeon before the procedure. To avoid this, ask your surgeon before the operation, will you have an assistant surgeon? Is that assistant in network with my insurance? If not, ask if an in-network assistant can be assigned. Trap number 5 is the radiology trap. If you have an X-ray, MRI, or CT scan at a hospital, the radiologist who reads the images may be a separate provider. That radiologist may be out of network. To avoid this, ask your doctor or the hospital, who will read my images? Is that radiologist in network? If not, ask if you can request an in-network radiologist. Now, let me give you a real-world example of how to avoid all these traps. A woman in New York needed a knee MRI. Her doctor wanted her to get it at the hospital imaging center. She asked the question, is the hospital imaging center considered a hospital outpatient department? What will my copay be? The answer was a $300 copay. She asked if there was an independent imaging center in network. There was. Her copay at the independent center was $50. She saved $250 by making one phone call. Here is your pre-procedure checklist. Before any medical service, ask these 5 questions. Question 1. Is this provider in network with my insurance? Question 2. Is this facility considered a hospital outpatient department? Question 3. Will there be any separate facility fees? Question 4. Will any ancillary providers like labs, radiologists, or anesthesiologists be involved, and are they in network? Question 5. Can I get a written estimate of my total out-of-pocket cost before I agree to the service? Now let me talk about how the UK and Canada are different. In the UK, the NHS does not have copays for core services. You do not pay for doctor visits, hospital stays, or surgeries. The concept of an in-network provider does not exist. The only charges are for prescriptions, dental, and optical services. So the copay trap is not an issue. However, if you have private health insurance in the UK, the same traps can apply. Some private plans have excesses or copayments for certain services. Always check your policy. In Canada, provincial health plans do not have copays for medically necessary doctor and hospital services. You do not pay to see a doctor or have surgery. However, private supplemental plans may have copays for prescriptions, dental, and physiotherapy. The same principle applies. Always ask about copays before you receive a service from a private provider. Let me also address the difference between a copay and coinsurance. A copay is a fixed dollar amount. Coinsurance is a percentage. For example, you might have a $50 copay for a specialist visit, or you might have 20% coinsurance for a hospital stay. Coinsurance can be even more dangerous because there is no cap. A 20% coinsurance on a $50,000 surgery is $10,000. That is why you need to understand your plan's out-of-pocket maximum. Once you hit that maximum, your insurance pays 100% of covered services. But until then, you are on the hook. Here is a hidden trick to lower your copay costs. Many insurance plans have a list of preferred labs, imaging centers, and pharmacies with lower copays. You can find this list on your insurer's website. Always check before you schedule a test or fill a prescription. One patient saved $400 on a blood test by driving 10 minutes further to a preferred lab. Another trick is to ask for a self-pay discount. If the cash price is lower than your copay, you can pay cash and not use your insurance. For example, a routine blood test might have a $50 copay, but the lab self-pay price might be $30. You can pay the $30 and save $20. This does not count toward your deductible, but for small services, it can be cheaper. Always ask, what is your self-pay price and how does it compare to my insurance copay? Let me give you a final warning. Some providers will ask you to pay your estimated copay at the time of service. They often guess wrong. They may overcharge you. If you pay up front, you may have to fight for a refund later. Instead, ask them to bill your insurance first. Then pay only the amount your insurance says you owe. You have the right to wait for the explanation of benefits. Let me recap the key takeaways. Number 1. Copays can vary based on where you receive care. Hospital outpatient departments often have much higher copays than independent clinics. Number 2. Always ask if a facility is a hospital outpatient department before you schedule an appointment. Number 3. Facility fees, pathology labs, assistant surgeons, and radiologists are common sources of surprise copays and coinsurance. Ask about each one. Number 4. Get a written estimate before any non-emergency procedure. Number 5. Check your insurer's list of preferred labs and imaging centers to find lower copays. Number 6. For small services, compare the self-pay price to your copay. You may save money by paying cash. Number 7. Do not pay estimated copays up front. Wait for your insurance to process the claim. Number 8. In the UK and Canada, copays are rare for core medical services, but can apply to private or supplemental care. Here is what I want you to do right now. Open your insurance card. Look on the back. There is a phone number for customer service. Call them and ask these 3 questions. What is my copay for a primary care office visit? What is my copay for a specialist office visit? And what is my copay for a hospital outpatient department visit? Write down the answers. Keep them in your wallet. Next time you schedule an appointment, you will know exactly what to ask. If this video helped you understand the copay trap and how to avoid it, hit the like button. It helps more people save money on their medical care. Subscribe and turn on notifications so you do not miss my next video, which is called the one phone call that can cut your medical bill in half, and comment below. Have you ever been surprised by a high copay? What happened? Share your story. I read every comment. Thanks for watching. Now go make that phone call. See you in the next one.